before I was a parent 2 years ago, I didn't even know there's universal childcare. And when I tell other parents, you know that in Quebec, they have universal childcare for $7 a day, they say, they do? And the other disconnection is that people are not aware of how much it costs. That's how expensive it is. So like, when I tell people, we get $1,200 a year for universal childcare benefit, but that's not even 1 month fee of daycare. It's like, that's right. $100 a month, and then you add it to the year, it's only $1,200 a year, but that's not even 1 month childcare. I can't even afford an infant program for that amount. And parents are like, that's right. You know, it's that disconnection. And also when you say, so by the time you're done paying on average $1,400 for an infant program, then all the way to preschooler, that's more than a doctorate degree. And people are like, that is a problem. Like, you know, because then people, like, and I think that's how, like, somehow that has to get out, that there is something that we can strive for, like universal childcare, so that awareness, and the disconnect that it's $7 a day and it works in Quebec, but here in Ontario, we're paying almost a doctor, like, tuition fee for daycare. And my personal, like, I have a personal issue right now with subsidy, and I had to write a formal letter to the ombuds people saying, you know what, I've been laid off, and you're giving me only 3 months in the worst recession we've had in over a decade to find work, so I can't continue to have my child in this care. And just giving them the statistics saying, you know, we rank 14th out of 14 of developing countries for investments in early childhood and childcare. And by the way, we're also ranked 25th at the UNICEF recent report. So when they saw that in black and white, do you think that they quickly reassessed my evaluation? They did, because that's like, not that they're not doing their job in terms of Toronto services, but it's like, that's right. Like, we should be advocating for parents and making it a hard time for me and following all these guidelines and policies. Like, so it's just my open thought that there's not awareness to parents that this is how much it costs us, and there's a disconnect between we're only getting $1,200 a year, and that's not even 1 month fee for an infant.
So put out the idea, right? So maybe there's a country that has an amazing food program that will use Quebec and then illustrate the problem. Do you have some suggestions?
So I'm here from the Ontario Coalition for Better Childcare. And first off, we want to thank Olivia because you've been really supportive of our work, and you've done lots of Canada's Children and for childcare campaigns in different ways a lot of the time. So thank you from everybody from our organization. There's some folks in the room who are here with us, some folks who couldn't make it who said their thanks. And I wanted to say that I agree, like a lot of parents, because we're always advocating for, like we're an advocacy group, we're a lobby group, and it's worked, like lobbying to a degree can work. Like last week we did a lobby at Queen's Park where we met with over 30 MPPs, and Captain Quinn spoke, and the Minister of Family and Youth Services, Deb Matthews, spoke. And we met with 30 MPPs throughout the day, and they announced $18 million in bridge funding, which is not enough. We want to stress that because, the federal funds are expiring. We needed $63.5 million to save it, and the provinces, I'm not saying it's solely because of the lobby, but I think it made a lot of difference, not just that day, but all the lobby work that's been done before the official lobby day has pushed the provincial government to give $18 million provincially in bridge funding. But again, it doesn't make up for what we're losing federally today. Yeah, it's for 1 year, exactly. So we have to keep pushing, and parents have to be involved because we can't keep advocating on behalf of people. And so we've been doing workshops all over the city, and a big part of our work is involving parents who are directly affected by the issue to visit their local MPP and say, if I had